Welcome to On the Beat, everyone. I'm over here with Dr. John Starr from Golden Triangle Periodontal Centre. Today we're talking all about supportive periodontal therapy. How are you, my friend?
I'm great.
Thanks for coming back again. Last time you were on, you gave us some great information, and I wanted to talk a little bit about periodontal therapy. Explain to everyone at home watching what it is to begin with.
Well, supportive periodontal treatment or therapy is the maintenance of your mouth, basically, maintaining the disease. As you know, periodontal disease is much like diabetes. Once it's under control, you got to control it.
Yeah, but what is it? Before we get to that, is it a gum disease? Is it what?
It's gum disease.
Okay.
I'm doing the therapy to prevent the return of the gum disease after treatment. See, and so typically when you see the dentist, you see them twice a year. You probably did that growing up as a child, and that's great. But when you have periodontal disease, we move that schedule from 6 months to 3 months.
I got you.
So we double the amount of time we see you as a patient. And what we're doing is breaking up the bacterial field every 90 days. So you can't get re-inoculated and get back in trouble from the bacteria.
Okay.
And regardless how good you brush and floss, you're going to build up calcium deposits, tartar, and it can creep down below the gum, and it acts like an irritant, and it's impacted with periodontal pathogens, bacteria,
Okay. Yeah.
And so we remove that, and so we get all that out of there, and so we can maintain your mouth.
How are you removing it?
We have special instruments that vibrate and squirt a medicine water in there.
Oh,
and
okay.
it's chlorhexidine gluconate, if you want to get technical, but it runs through it and knocks all that stuff off, and we
So
hand
you're
scale
awake?
it. Yes, it's not painful.
Is this what you call like a deep clean?
Some
like
people,
a deep clean?
Well, some people refer to scaling root planing.
Ah, that's what I mean.
Okay, deep cleaning, and that you would have to have anesthesia for that. But we're talking about post-treatment, where we got you back in good shape, and then we don't have to anesthetize you. Of course, we will if you have a sensitive spot, but most of the time we don't have to anesthetize you. We can use topicals or just.
Well, I'm sensitive.
You're sensitive.
Yep.
We can fix that.
I need the drug.
Yeah, and we got great drugs for that. But
Okay, now, how do I know I have periodontal issues if I don't know what it's all about? Like we've talked about gum disease. How do I know at home that I need to call you?
Well, of course, if you see blood in after you brush and floss and on your floss and something, that's the signs and symptoms of an inflammation. But on supportive periodontal treatment, it's mainly post-periodontal treatment, so that we're holding the line, so to speak, against the disease. Because disease is relentless. You're not going to ever be cured.
I was going to ask you that.
Yeah. You know,
so once it's done, it stays there?
It's there, but you can get it back where you can control it, similar to diabetes.
Okay.
You know, diabetes is an awful disease, but it can be controlled and maintained well.
Yeah. I got you.
And so this could be taken care of.
So
like
this
that.
is an ongoing process.
Yes.
You said something to me off camera that you really like working with their local dentist as well, like sort of tag teaming on these. Why do you find that super important?
Well, it's a relationship between us. We're a team, and we're there to treat the patient for their periodontal problem. So once I get it under control, we start alternating their cleaning schedules, their supportive periodontal treatments. Therefore, 4 hours better than 2. For example, I'm not going to find a cavity or a chipped tooth as quickly as the guy that's looking for those every day. I, on the other hand, will find the periodontal issues if they start to get back in trouble quicker than they do, because that's what I do every day. So we alternate those treatments. Now, that's not my plan or the general dentist plan. That's the studies that show that that works the best for preventing tooth loss.
Worst case scenario, well, I think you just answered my question. Worst case scenario, do nothing about it, what happens?
Lose your teeth.
There it is, people. You can't walk around not having a fabulous smile.
That's a fact.
Agree?
Agree.
Appreciate you coming in again. If you want to find out more information, there it all is up on the screen, my friends. Golden Triangle Periodontal Centre. Give Dr. John Starr a call. He's going to put you on your right foot for that everlasting, crispy, youthful white smile.